to find out more.
Welcome to News on Zodiac with me, Sibongiriziambo. The headlines at this hour. Death robs Parliament of 2 lawmakers, pushing the vacancy of MPs to 3. Government jointly with partners establishes food insecurity response program to save 2.6 million lives. High Court in Zomba sentences 2 men to 40 and 30 years imprisonment for defilements. And across the borders, Tanzania's John Magufuli warns health officials against acquiring COVID-19 vaccines. My name is Sibongiriziambo. Thank you for joining me. Parliament has lost 2 of its members, Mrs. Jacqueline Chikuta for Nchisi North and Mr. John Chikalimba for Zomba Changalumi. Mrs. Chikuta died upon revival at Mtengwa Hospital, while Mr. Chikalimba passed on at Zomba Central Hospital, where he was receiving treatment. Spokesperson for the National Assembly, Ian Mwenye, has confirmed the sad news development but could not give more details, saying Parliament will soon issue a statement on the same.
Yes, I can confirm that the Office of the Speaker has indeed received the very sad news regarding 2 honourable members, Honourable Chikuta and indeed the Honourable John Chikalimba as well. We are shocked, we are lost of words, we are distressed. We are going to issue further details, more details regarding the senior arrangement of our late honourable members. So at the moment, that's how far I can go.
Government jointly with United Nations and other partners have established a national food insecurity response program to reach out to 2.6 million food insecure people requiring immediate support in the lean season. Through the program, the Department of Disaster Management Affairs, the World Food Program and other collaborators will provide food and cash to the affected this season. The action follows a Malawi Vulnerability Assessment Committee MVAC estimate that 3 million of the country's 20 million people are in severe need of food ahead of the next harvest. This report filed by Gabriel Kamlomo.
The vulnerable include people from rural areas which experience localized low levels of crop production and others in urban areas experiencing COVID-19 triggered socio-economic hardships, while pledging government commitment to helping vulnerable households mitigate, manage and recover from their situation. Commissioner for Disaster Management Affairs, James Chusiwa, observes that increasing risk of climatic shocks worsens a vicious cycle of food insecurity. WFP Malawi Country Director Bino Titire says support that donors have made available to the program will reach people who risk slipping further into hunger. The joint SDG Fund, as well as Norway, United Kingdom and United States of America, have made available 37.8 billion kwacha for the program, 10.8 billion kwacha less than the budgeted 48.6 billion kwacha plan. The government of Malawi has allocated 30,000 metric tons of maize to the program from the Strategic Grain Reserve. Continued food and nutrition insecurity in Malawi is blamed on overdependence on rain-fed agriculture and absence of crop diversification.
Meanwhile, the European Union has committed 56.6 billion kwacha towards COVID-19 response programs in the country. EU Head of Cooperation Ivor Hopkins said on Tuesday that the funds will mainly be used in mitigating the socio-economic impact among the ultra-poor through social cash transfer programs, sanitation and hygiene interventions. Fanani Urenda reports.
As Malawi continues to register new COVID-19 infections at an alarming rate, the European Union, jointly with the Irish Cooperation and German Cooperation, have committed 56.6 billion kwacha towards the COVID-19 response in the country. EU Head of Cooperation Ivor Hopkins told Zodiac the money will mainly go towards promoting sanitation and hygiene interventions, supporting the school meals program, as well as ensuring that the ultra-poor Malawians are protected against the socio-economic impact of the pandemic.
Well, with its restrictive measures,
A lot of people, certainly in the informal sectors, are losing out on their livelihoods, or are losing income, living day by day of what they can earn, and with restrictions, these incomes are jeopardized. So the social cash transfers, which is a government program and is constant in the rural areas, there is clearly a need to expand that to urban areas and to target the ultra poor in the urban areas that have seen their livelihoods affected by the restrictive measures.
Presidential Task Force on COVID-19 co-chairperson Dr. John Puka said he cannot comment on the matter as they have not been officially updated on the support from EU. The country is experiencing a rise in COVID-19 infections with more than 12,000 active cases, with stakeholders grappling to control the further spread of the virus. Meanwhile, other individuals and groupings have gone flat out in mobilizing resources to help our ailing health systems cope with the surge in infections. For Zodiac, I am Vonani Renda.
Staying on COVID-19, the Directorate of Road Traffic and Safety Services in the Ministry of Transport and Public Works maintains that passenger capacity on commuter vehicles is at 60% in efforts to decelerate the spread of COVID-19. This comes hot on the heels of a service delivery boycott by drivers of commuter vehicles in all the cities and some districts on Tuesday. The boycotts were called off on the basis that government had conceded to allowing operators take on board normal passenger capacity. Government says this is inaccurate. This report read by Gabriel Kamlomo.
In a statement issued last evening, Deputy Transport Minister Nancy Chaola warns that failure to adhere to measures announced will attract a fine of 100,000 kwacha and operator licenses could be revoked. Meanwhile, passenger capacity for buses, minibuses and taxis remains reduced by 60%. Tricycle to carry a maximum of one passenger, and goods vehicles shall carry the driver and one passenger in front seat. The Deputy Minister says law enforcement will remove any excess passengers. She says drivers, assistants and passengers shall be expected to wear face masks fully covering the nose and mouth at all times.
In Blantyre, some minibus drivers continued to resist and proceeded with protests against the new seating guidelines. There were ugly scenes in some areas such as Machinjiri, where police fired tear gas to disperse protesters. Our reporter Hapin Jalamano explains from Blantyre.
Just like yesterday, commuters had challenges today to move from their homes to their respective destinations. The only difference is that today some minibus drivers were seen ferrying people to town, but not as they usually do, because they had to change the routes. Because the protesting drivers, whenever they find that one is ferrying people, those vehicles were forced to stop and disembark all the passengers from the vehicles, because they are not happy with the rising price of fuel and the amended seating capacity in minibuses, whereby only 2 passengers are occupying a seat. So their plea to government is to either reduce the fuel price or revert to the old seating capacities, whereby 3 passengers were occupying a seat. In some areas where the city things were violent, for example in Machinjiri, police had to fire tear gas to disperse the irate protesters. Spokesperson for Olimbi Police Station, Patrick Musa, said that police are on the ground to make sure that there's peace, calm and order.
Health workers and support staff at Monkey Bay Community Hospital in Mangochi have rebuffed a plea by their bosses to resume work. Ronald Gonti, a representative of the workers, said they want their bosses to hear them out first before asking them to end the sit-in. The workers want some officers at the facility to be dismissed, accusing them of mismanaging resources, including funds for COVID-19 response. Mangochi District Hospital spokesperson Harold Kabuluzi told us on Tuesday that they have talked to the disgruntled workers and will resume with their work, waiting for a full hearing this Tuesday. Rafael Mozua caught up with Gonti.
That decision has been made by themselves so that we can go back to our working areas, and upon receiving that response, we did not agree to do what they said. Instead, yesterday we agreed to meet at the facility so that we can continue with sit-in. So what is happening today? Today we are continuing with the sit-in until they came from Mangochi District Hospital so that we can assess all the issues which we are fighting for. In class, the gate has been closed. Like yesterday, it was closed the whole day, and also today it has been closed. So we are not allowing any entry.
So what about the patients that were already admitted at the hospital?
We have scheduled external staff who are assisting them, depending on their problems. We have not just left them. We have considered them. But if the responsible guys from Gate 4 are not coming, then we are going maybe to release them. Those people who are taking care of them in the road, we are going to take them out so that maybe they can join us.
You're watching news on Zodiac. We'll be back with more news shortly after the break. Stand by.
Wherever you go, a better future begins right here. So be part of this beautiful beginning. Malawi Adventist University Blantyre campus is inviting qualified persons to apply for admission into the 2-year Bachelor of Business Administration upgrading programs with concentration in marketing, accounting and management. Deposit an application fee of 10,000 kwacha to Malawi Adventist University, Standard Bank in Cheu branch, account number 910000744082. Download application forms at www.mau.ac.mw or collect them from Blantyre campus.
Email blantyrecampus@mau.adventist.org.
Your future awaits. Just come and learn how to grab it. Malawi Adventist University. Knowledge, truth, service.
Kodi ndinu nomwe somuzitichwa ulemekezeka kodi? Aya.
Koma mwachedo atu. Nakatobwera nazo drama zanozi.
Oh.
Mbona kuchedo?
Kungoti ndinadzera ku Audible. Ndimakasiya mafomu ofotokoza za chuma, business komanso za ngongole zimene ndili nazo. Azathu munakaulula kale ngati.
Ayi. Komanso ndinezoulula zimangoona ngati mkungotcherana misampha chabe.
Kutcherana misampha kotani?
Olemekezeka.
Inu chuma choti mwachipeza mwachilungamo ungachite mantha? Kapena tumwina mufuna mutapeza chuma chanu kudzera munjira zosalongosoka koma pogwiritsa ntchito dindo wanu.
Eso sichoncho.
Mwinatu. Chifukwa ineyo ngati MP. Inunso ngati munthu amene muli ndi udindo kuboma. Tinayenera kuulula chuma chathu, mabizinesi athu ku Audible. Tisachite kudikira kuti mpaka nati kumbutse iyayi. Komanso anthu amene ine ndimatumikira anene okhala ndi chikhulupiriro mwa ineyo.
Zoona ndi.
Yetu. Mpaka na maina athu mpaka nati chiti discipline.
Isizabwino.
Ndipanga zomwezo komanso ndizawuza koso anzanga yena.
Akuluakulu ogwira ntchito zaboma kandi ife amaudindo ochita kusankhidwa ndi anthu kapena ndife ochita kulembedwa tikuyenera kuulula chuma, ngongole komanso mabizinesi omwe tili nawo ku Audible kuti tipewe kuyimbidwa mlandu, kuyimitsidwa kapena kuchosedwa ntchito kumene. Uthengawo ukukufikani kuchokera ku Office of the Director of Public Officers Declarations, Audible.
If there's one thing that all soaps do, it's wash. From buckets to basins, bathrooms to streams, and everything in between.
All soaps wash.
Yes, but Protex is different. Its reinvented formula with flaxseed oil boosts your skin's natural anti-germ defenses by 10 times more, protecting you against 99.9% of germs. So what keeps us healthy?
Protex!
Good health starts here.
Precious things have a secret formula. While John is busy trying to impress, James discovered Tangu's secret. Tangu uses Purity sanitary products from Purity body wash, Purity hands wash, Purity body lotion to Purity dishwash. After a week of using Purity sanitary products, James won the heart of Tango. Use Purity sanitary products.
Welcome back. You're with me, Sibongile Ziambo. Let's continue the news by looking at the headlines. Death robs Parliament of 2 lawmakers, pushing the vacancy of MPs to 3. Government jointly with partners establishes food insecurity response program to save 2.6 million lives. High Court in Zomba sentences 2 men to 40 and 30 years imprisonment for defilement. And across the borders, Tanzania's John Magufuli warns health officials against acquiring COVID-19 vaccines. The High Court in Zomba has sentenced 2 men to 40 and 30 years imprisonment respectively after being convicted of defilement. Judge Redson Kapindu sentenced Maliko Fabiano to 40 years for defilement of a 10-year-old girl and Zeshani Jirao Raja to 30 years for defilement and 20 years for an abduction of a 15-year-old girl. In both cases, the convicts appealed against sentences handed by magistrates' courts. And government has sent for testing samples of an Indian-made fertilizer following complaints from farmers that the fertilizer had damaged their crops, including tobacco and maize. Ministry of Agriculture spokesperson Gresham Lungu has confirmed that the ministry received complaints from farmers who have used the debadged fertilizer and that samples are now with the ministry's research department and ARIT. Meanwhile, the Malawi Bureau of Standards (MBS) says it needs to establish the batch of the Indian-made fertilizer which the farmers have used and the complications. Tawera Kumwenda filed this report.
More than 300 hectares of tobacco land in the country is said to have been affected after farmers applied debadged fertilizer manufactured in India. Some farmers in Zimba North and Kasungu told Zodiac that soon after applying debadged fertilizer, the tobacco and maize shrank, and there is no hope they will harvest anything from their fields. Speaking to Zodiac on Tuesday, Minister of Agriculture spokesperson Gresham Lungu acknowledged receiving reports about the fertilizer, which he says is a certified brand. He, however, said the ministry is waiting for findings of investigations being conducted by its research department in collaboration with Agriculture Research and Extension Trust ARET. Lungu said the research will establish if the fertilizer has elements that have affected the crops.
Currently, we can say the fertilizers are certified, and we cannot say that the reason is because of the fertilizer for now, because the investigations are still in the process. Because when we went into the field with the minister and the other officials from the research department, we collected some samples and some data, and the research team is still working on the investigation to come up with a report on what could be the reason why the plants are drying.
ARES Chief Executive Officer Dr. Abba Changaya said samples have been sent to a lab in Germany and the results will be out soon.
So we've actually used the other sources to send the fertilizer samples to laboratory outside the country, and we're waiting for the results.
Meanwhile, Malawi Bureau of Standards Quality Assurance Services Director Wananga Sindani said the Bureau is looking to find the batch of the fertilizer, as that is when it can take action.
You see on that, the fertilizer has the right thing, unless we know the batch of that fertilizer. When was it imported? Because we have seen situations where importers have kept the product for more than 5 years. So we are not very sure as to whether that product was monitored this year or was monitored the last 3 years, unless we say what is this product, what is the batch, and then we trace it.
For Zodiac in Zuzu, I'm Tawera Kumwenda.
We now go to sports news. The Volleyball Association of Malawi says it wants creative and ambitious candidates to establish sound structures and revive the sport from the grassroots level. VAM General Secretary Lazarus Chakwera has said this ahead of elections for the Central and Northern Regions Executive Committees this Saturday in Ilongwe and Mzuzu respectively. Chakwera says the sport, despite its popularity, has failed to have an impact because of lack of ineffective means of running the sport. In news from across the borders, Tanzania's President John Magufuli has warned health officials against acquiring COVID-19 vaccines, saying without giving evidence that they could harm the population. Mr. Magufuli cautioned Ministry of Health officials that they should not hurry to try the vaccines without doing research because not every vaccine is important to people in his country. He urged Tanzanians to continue taking precautions, saying prayers and traditional medicine, including steam inhalation, were the way to deal with coronavirus. BBC health reporter Philippa Roxby says vaccines are rigorously tested in trials involving thousands of people before being assessed by regulators who look at all the data on the safety and effectiveness of vaccines before approving them for the use on a wider population. And that's how we conclude this edition of news. And before we go, a look at the top stories. Death robs Parliament of 2 lawmakers, pushing the vacancy of MPs to 3. The government jointly with partners establishes food insecurity response program to save 2.6 million lives. And High Court in Zomba sentences 2 men to 40 and 30 years imprisonment for defilement. And in news from across the borders, Tanzania's John Magufuli warns health officials against acquiring COVID-19 vaccines. Visit our website zodiacmalawi.com for more on these and other stories. My name is Sibongili Ziambo. Thank you for watching. Bye for now.